A new poll by the New York Times and CBS finds that only 24% of the public wants health care reform entirely kept in place. What do you think the plan should be if the Supreme Court strikes it down, and do you think this is something that Congress should take up immediately if Obama is reelected?
You know, I'll just start on this one because I think I get the big one here. I want to say one thing. When we say only 24% of the public wants health care reforms left in place exactly as they are, how much have we made the case for what's in health care reforms? How much have we gotten out there and sold it? The answer is not very much. There's been plenty of attack and very little about what health care reforms are. You know, I live in Massachusetts. I'm proud to be from Massachusetts. We are a place in the country with universal coverage, but the Affordable Care Act still has a lot of features to it that are important to us. Kids up until age 26 can stay on their parents' policies. It cuts the donut hole in Medicare. This is our one big chance to find ways to bring health care costs under control, to invest in the research so that we can get better outcomes at lower cost. I think the first step is we need to get out there and make the case for the Affordable Care Act. I'm ready to do that. I think that's right.
So you think if the president is reelected, it's something that Congress should take up again and discuss?
Let me put it this way. I think we need to explain to the American people every single day what the benefits of the Affordable Care Act are. I do.
Can I jump in here? Can people hear me with this? Whoa. I was there when we dealt with the health care bill, and I must say that we knew that we were really not getting the message out clearly, and it distressed me when I saw the figures that you cite, Amanda. And what it said to me was that there's so many good parts to this healthcare law that it is clear to me that the messaging is still not out there. So Elizabeth, you're right on the money on that. We need to do a better job because there are literally millions of people who are women are really being helped by the fact that we no longer allow insurance companies to charge women more just because they're women. Come on, how right could that be? You know, the women of this country need to mobilize and understand. We need to help get that word out that the women in this country are helped by this healthcare law, that the young people in this country are helped by this healthcare law, the seniors are helped. There are millions of people who are being helped by this healthcare law, and we have not done as good a job as we could, and that's where you all come in again. The power of Netroots is amazing, because you did that when we dealt with the Susan G. Komen. Remember that? How you mobilized everybody, and within a day, they had already decided, okay, they're going to keep funding Planned Parenthood. So the mobilization, the education is, I think, what's key, because healthcare costs in this country are not going to go down unless we do the kinds of changes and continue to push for the kinds of reforms that will really enable everyone in our country to have healthcare. That is a right.
Congresswoman, I just wanted to follow up. Since you were in Congress and you saw how acrimonious it was, it will be an issue if the Supreme Court does strike it down. Do you think it's wise for Congress to take this up again?
I think that we need to, because there are millions of people in our country who otherwise would be totally left bare. 40 million people in our country without any kind of health care. So it's not an issue that is going to go away. I think that we need the kind of focused leadership that will continue to bring this to the fore. And you know what? I am hopeful that this Supreme Court is not going to do a 5-4 decision on the Affordable Care Act. I'm hopeful that this court is going to say this is so important, and it has to do with the powers, some fundamental powers of Congress to effect changes that protect the health, safety, and welfare of our people. And it should not be a 5-4 decision, because if it is, then what that says to me is it's a political, ideologically motivated decision.
So I have yet to talk to a voter who thinks it would be a good idea to allow insurance companies to say that they won't insure my friend Owen, who is 10 and recovering from leukemia. I have yet to talk to a voter who thinks it's a good idea to let insurance companies discriminate against women who have recovered from breast cancer. I have yet to talk to a voter who thinks it's a good idea to let the insurance companies profit enormously from a captive audience while we have no checks on their behavior. When we talk about what's actually in the Affordable Care Act, people support it, and that's what we have to do.
Right.